Welcome to UMCC Medical Consultant Connectors, where your health matters to us. Understanding hip fractures. A common injury. A hip fracture is a break in the upper part of the thigh bone, or femur, which fits into the hip socket. This is a serious injury that most often affects older adults. Hip fractures are common, with millions occurring worldwide each year. They can significantly impact mobility and independence. While anyone can experience a hip fracture, they are much more prevalent in older adults, particularly those over the age of 65. This is because bones tend to weaken with age, making them more susceptible to fractures. Hip fractures often occur due to falls, which are a leading cause of injury in older adults. A simple trip or stumble can lead to a fracture, especially in individuals with underlying bone weakness. Understanding the causes, risk factors, and preventive measures is crucial for protecting bone health and reducing the risk of hip fractures. Causes of hip fractures, why they happen. The most common cause of hip fractures is a fall. As we age, our bones naturally become thinner and weaker, making them more susceptible to breaking, even from a minor fall. This weakening of the bones is a condition known as osteoporosis. Falls are particularly dangerous for older adults because they may have reduced reflexes and balance, making it harder to catch themselves or break a fall. Factors such as poor eyesight, medications that cause dizziness, and home hazards like loose rugs or poor lighting can further increase the risk of a fall. In addition to falls, other less common causes of hip fractures include high-impact injuries from car accidents or sports, as well as medical conditions that weaken the bones, such as cancer or osteoporosis. It's important to be aware of these causes and take steps to prevent falls and maintain bone health. Risk factors. Who is more likely to experience a hip fracture? While age is a significant risk factor for hip fractures, certain individuals are more susceptible than others. Understanding these risk factors can help identify those who may benefit from preventative measures and medical intervention. Osteoporosis, a condition characterized by low bone density and increased fragility, is a major risk factor for hip fractures. Women are more prone to osteoporosis, especially after menopause, due to hormonal changes that affect bone density. Other risk factors include a family history of hip fractures, certain medical conditions such as rheumatoid arthritis or thyroid disorders, smoking, excessive alcohol consumption, and prolonged use of certain medications like corticosteroids. Nutritional deficiencies, particularly in calcium and vitamin D, can also contribute to weak bones and increase the risk of fractures. Recognizing the signs and symptoms of a hip fracture is crucial for prompt medical attention and optimal recovery. A hip fracture is a serious injury that requires immediate medical care. The most common symptom of a hip fracture is severe pain in the hip or groin area, especially when trying to move or put weight on the affected leg. The pain may be intense and debilitating, making it difficult or impossible to walk or stand. Other symptoms may include swelling, bruising, and tenderness around the hip area. The injured leg may appear shorter than the unaffected leg, and it may be externally rotated, meaning it turns outward. In some cases, numbness or tingling in the leg or foot may also occur. Treatment for a hip fracture typically depends on the severity and location of the fracture, as well as the overall health and age of the individual. The goal of treatment is to relieve pain, stabilize the fracture, and restore mobility. In some cases, non-surgical treatment options may be considered, particularly for minor fractures or individuals who are not healthy enough for surgery. These options may include bed rest, pain medication, physical therapy, and the use of assistive devices like walkers or crutches. However, surgery is often the preferred treatment for most hip fractures, as it allows for faster healing, earlier mobilization, and a lower risk of complications. The type of surgery performed will depend on the specific fracture pattern. Common surgical procedures include internal fixation, where the broken bones are held together with screws or plates, and hip replacement surgery, where the damaged hip joint is replaced with an artificial one. While hip fractures are a serious concern, there are steps you can take to reduce your risk and maintain strong, healthy bones throughout life. Prevention strategies focus on lifestyle modifications that promote bone health and reduce the risk of falls. one of the most important things you can do is to get enough calcium and vitamin D, either through your diet or supplements. Calcium is essential for building and maintaining strong bones, while vitamin D helps your body absorb calcium. Regular weight-bearing exercises, such as walking, jogging, or dancing, are crucial for stimulating bone growth and improving bone density. Strength training exercises, using weights or resistance bands, can also help build muscle mass and improve balance, reducing the risk of falls. Maintaining a healthy weight, avoiding smoking, and limiting alcohol consumption are also essential for optimal bone health. UMCCC, your ultimate medical consultant connector.